Okay, continuing my presentation. Okay, many people don't realize, I know I didn't realize it, that caffeine is a drug, and it's the most popular one. And I think a lot of people do realize that caffeine is highly addictive. However, when it comes to defining it as a drug, we forget, or we don't even realize that it is one. Our wellness book states caffeine is probably the most popular psychoactive drug and also one of the most ancient. It is found in coffee, tea, cocoa, soft drinks, headache remedies, and OTC preparations like no-dose. Caffeine is also in energy drinks, which has become increasingly popular today. And did you know you can die from caffeine? You can overdose, and it may take a lot to make that happen, but it is possible. It's more lethal than you would imagine, and it becomes even more harmful when mixed with other drugs, such as alcohol or any other type of drugs. It can cause reactions that can be harmful to the body. Energy drinks, as I mentioned earlier, are becoming so much more popular. Studies show that 22 to 66.5%, that's a big gap, but there's been so many studies that they haven't had an exact amount, but that percent of college students consume energy drinks. Benefits include alertness, reduce fatigue, and increase motor activity. Some claim that it enhances athletic performance as well as assists in weight loss. And most of these benefits all come from caffeine. It stimulates the central nervous system. However, studies show the use of energy drinks and associated caffeine content for sports performances has been linked to unintended consequences such as cardiac events, anxiety, seizures, tremors, vomiting, and death. Here's a chart that shows deaths from opioid pain relievers and illegal drugs. Deaths from overdose and prescribed pain relievers has more than quadrupled in the past 15 years. More than 2 million people in the United States suffer from substance use disorders related to prescription opioid pain relievers. The terrible consequences of this trend include overdose deaths, which have more than quadrupled in the past decade and a half. The causes are complex, but they include overprescription of pain medication. In 2013, 207 million prescriptions were written for prescription opioid pain medications. People often think that prescription OTC drugs are safer than illicit drugs, but they can be as addictive and dangerous and put users at risk for other adverse health effects, including overdose, especially when taken along with other drugs or alcohol. Before prescribed drugs, a healthcare provider considers a patient's health conditions, current and prior drug use, and other medicines to assess the risks and benefit for a patient. That was all from the National Institute on Drug Abuse. So as I mentioned earlier, study drugs or prescribed drugs that are not necessarily used for the prescription. The study has shown that they do not make you smarter. And so the study is from the University of Toronto, and it claims that individuals who do not qualify for ADHD diagnosis have not exhibited significant effects of these medications on test performance in comparison to those taking a placebo. Although individuals may believe these drugs improve performance, as stated in a study that administered mixed amphetamine salts to young adults and compared their performances on a range of cognitive tests. A standard clinical dose of a drug that is commonly used for cognitive enhancement did not enhance cognition. It does enhance cognition among healthy and adequately rested young adults. The effects are likely to be small. Although the non-medically stimulant use may not translate into test performance improvement, this does not mean that fatigue students are simply mistaken about drug effects. Stimulants have demonstrated effects of alertness and decreased fatigue, and so may allow for prolonged periods of studying. End quote. So, although it can make you concentrate more and become more alert, it's not prolonged, and the comparison for those who do use them and don't, are not significant enough to say that it would make you smarter. The National Institute on Drug Abuse also stated ADHD drugs like Adderall are also often abused by students seeking to improve their academic performance. However, although they may boost alertness, there is little evidence they improve cognitive functioning for those without a medical condition. So, what do we conclude from all of this? Don't do drugs. It's as simple as that. And the effects are just not worth it. So don't do it. That's my recommendation. And it's really just as simple as that. Here are my references. I definitely quoted a lot of things, found a lot of facts from all of these websites. And there's my presentation. Hope you enjoyed it.